Module Overview. Personal hygiene and grooming are fundamental components of holistic patient care. Beyond just keeping the body clean, they significantly affect a patient's self-esteem, dignity, comfort, social interaction, infection prevention, and overall quality of life. In the clinical setting, proper hygiene practices directly reduce healthcare-associated infections, HAIs, minimize skin breakdown, and enhance the patient's physical and emotional well-being. This module trains caregivers in both routine hygiene procedures and sensitive, respectful handling of patients with varying degrees of independence and vulnerability. Importance of personal hygiene in patient care. Hygiene is not simply a matter of cleanliness, it is central to preventing infections, e.g., pressure sores, urinary tract infections, maintaining skin integrity, improving circulatory function, boosting mental health and self-image, promoting recovery and mobility, preventing hospital-acquired infections, HAIs. When personal hygiene is neglected, patients may experience discomfort, depression, feelings of worthlessness, increased health complications. For patients who are bedridden or disabled, even basic grooming helps them retain a sense of normalcy and identity. Components of personal hygiene and grooming. Key areas of hygiene include bathing, full bed bath, partial bath, sponge bath, or shower depending on patient condition. Oral care, brushing teeth, denture care, and mouth rinsing, especially for unconscious or intubated patients to prevent ventilator-associated pneumonia, VAP. Hair care, brushing, shampooing, trimming, important for comfort and dignity. Nail and foot care, cutting nails, washing feet, moisturizing to avoid fungal infections or pressure ulcers. Perineal care, especially for incontinent or catheterized patients, prevents UTIs shaving. For male patients or others by preference, carried out with caution to prevent cuts or irritation. Eye and ear care, cleaning crust or secretions carefully with warm, damp cloth. Each of these tasks must be done with respect for the patient's privacy, modesty, and autonomy. Hygiene for different patient categories. Patients have varying levels of independence. Independent, need minimal prompting or assistance. Partially dependent, need assistance with certain steps. Totally dependent, require full support and repositioning. Bedridden patients, palliative patients, psychiatric patients, elderly, or those with spinal injuries all require customized hygiene routines to suit medical needs and reduce distress. Safety considerations in hygiene procedures. When providing hygiene, safety is paramount. Ensure water temperature is appropriate to avoid burns. Use gloves during intimate care or handling waste. Position the patient safely, especially during bed baths. Use non-slip mats or assistance when showering. Ensure proper body mechanics to avoid injury to caregiver or patient. Caregivers must be alert to signs of skin breakdown, e.g., redness, blisters, infections, e.g., foul odors, pus, pain or discomfort during care. Document and report abnormalities to supervisors or nurses. Patient privacy, consent, and cultural sensitivity. Maintaining privacy involves closing curtains and doors, using blankets to drape non-exposed parts, knocking before entering. Always obtain verbal or implied consent before initiating hygiene care, even if the patient is nonverbal. Respect gender preferences, religious considerations, and cultural norms around touch, body exposure, and grooming. For example, some female patients may prefer female caregivers for bathing. Certain cultures prohibit shaving hair or require covering of specific body parts. Supplies and equipment for hygiene. Common items include soap, liquid antibacterial, washcloths and towels, disposable gloves, bedpan or urinal toothbrushes and toothpaste, shampoo, comb and razors, moisturizers and deodorants, clean linens and incontinence pads. All equipment must be clean and sterile when required. Organized before starting, disposed of properly after use. Reusables should be disinfected according to infection control policies. Documentation and communication. Caregivers must document hygiene care provided, noting time of procedure, patient response, observed conditions, rashes, sores, bleeding, products used, refusals or non-compliance. Clear communication with the nursing team ensures that patient care plans are updated and any abnormalities are escalated. Barriers to effective hygiene provision. Common barriers include patient resistance or embarrassment, time pressure in hospitals, lack of supplies, language differences, staff shortages. These can be overcome by building trust and rapport with the patient, explaining each step clearly, advocating for proper staffing and resources, using visual aids or interpreters when necessary.